Is it good to delay the diagnosis of a serious injury or any serious condition of the body? The answer, of course, is no. So if a patient has a cancer, and let's say they have two cancers, but you only diagnosed one of the cancers, is that going to be a problem for that patient's treatment and their results and their health and their future? The answer is a resoundingly yes. Spinal injuries are no different. Spinal injuries are the number one, the first, fourth, and sixth leading cause of chronic pain and disability. The first being the lumbar spine, the fourth being the cervical spine, and the sixth being headaches, most commonly caused by the injury to the cervical spine. So these are the most expensive injuries in the market today. When a patient is injured, by research, 55% or more of them will never fully recover. These are the most problematic injuries in the market today. Anyone that minimizes these injuries, especially if you're a physician in this space that's treating these injuries, is minimizing yourself and the condition that you work with. These are the most serious injuries that there are. And any doctor that can do three things very well: they can diagnose it because they understand what to look for. They can treat it successfully. That means the patient's resolved with no chronic pain, no pain at the resolution of treatment, or no problems in their activities of daily living as a result of this injury. And then three, can document it so that people in the injury space can easily determine benefits. To get the settlement process to resolve very quickly should be the highest paid doctors in the market, bar none. But what happens if the patient has a delay? We see very many times, and this should never be occurring. I'm sad that it is occurring today, but it's occurring on a regular basis, where a patient will be under care for 6 months, 12 months with a doctor, and they have a serious underlying spinal ligament injury that has gone undetected. So spinal ligament injuries are twofold. You have the disc, which is one of the ligaments. You pick that up with a herniation on a study. On the other, you have the spinal support ligament injury, and that's picked up through an accurate excessive motions test. So the more excessive motion is the imaging biomarker for the spinal support ligament injury damage. MRI herniation is the imaging biomarker for the disc condition. And oftentimes you'll have a combination of both, where you have excessive motion with the disc herniation, which also indicates that the disc herniation was caused in the accident and not a pre-existing condition. So when a doctor delays understanding, I don't believe personally, I'm the CEO of Spinal Kinetics, I do not believe personally that a patient should be treating with a doctor where the doctor is missing the underlying injury. Because I know from my experience, years and years with this, that patient is not going to get as good results as the doctor who fully understands the condition. Now, in the market, unfortunately, since no one was trained on spinal injuries, there is no formalized education in any chiropractic college on spinal injuries. There's no formalized education in any medical school in the country, osteopathy school in the country, or doctor of PT school in the country. The first, fourth, and sixth leading cause of chronic pain and disability, no formalized education with any of the schools in any of the various professions. So that's a problem in the market today, and that problem has led to severe chronicity rates. It's led to doctors that are not understanding exactly what it is that they're treating. Because in order to understand what you're treating, you first have to do the diagnostics. You first have to understand what it is that the patient has. And remember, you cannot have any injury to any body part without deranging that body part. The derangements of the spine are easy. There's only two parts. There's bone and connective tissue. So if bone is a fracture, obviously. Connective tissue is twofold. Herniation found on MRI, excessive motion found on functional radiology studies. And you want those functional radiology studies to be done by an unbiased, independent providers, such as Spinal Kinetics. The reason why I say that, and people mistake why I say that, is, oh, I got a vested interest because I'm the CEO of Spinal Kinetics. And yes, I can see where you would have that point, but the findings are so significant that I, as a practitioner, always wanted them done by an unbiased third party. So there was no provider bias entered into it. Today, with some of the softwares, some of these softwares that are out there are highly problematic. They're very problematic. Plus, the providers are you're plotting your own points on the study itself. So you're also doing things like screen captures of your image, all things that decrease and reduce the accuracy of the study. So, you know, you want to basically have a very accurate study. In my case and in my experience, it was always best to have a group, which I did in my private practice. I sent out to a group, that's what they focused on. So I could focus on other things. But the biggest thing is I never delayed in the diagnosis of these injuries. I never minimized how serious these injuries were. I never minimized what my role was as a provider. And that's what I highly recommend that you or the doctors in the market, you that I'm speaking to right now, I highly recommend that that's what you do as well. Now, there is some in the market that say, because you don't want that delay in diagnosis. You want to be, that patient needs to be with a doctor that understands this condition right away. And if you don't understand this condition, education is where you need to be at. You need to understand more and more. If you're going to treat spinal injuries, then you should know every inside and out about these injuries. And again, they're very simple because there's only 3 injuries you can have: an excessive motion herniation or fracture or combinations thereof. So there are providers that think that they can look at the x-rays and just see how much excessive motion there is. I'm going to challenge you right now that you can't do that. I know, because I've built systems that do it. I've helped with AI that does it. With our AI at Spinal Kinetics, we've evolved the spinal excessive motion testing industry. We've set the bar so high now that this is standardly the way it needs to be done, because that's the way you can really accurately get a good excessive motion study. And by the way, our AI is FDA cleared. So anyone thinks you can see, because what comes up is, well, I look at the x-rays and if I don't see anything, I don't send in. And that's pretty, I know when I hear that I'm dealing with a provider that doesn't really understand the injuries. Take no offense if that's your position, but I know that you don't fully understand these injuries because you can't see them. My challenge to you is, if you can, click the challenge down below. Pick out the set of films that has a severe spinal ligament injury on it. The most severe in these films has what's called alteration motion segment integrity. Tell me the films, tell me the level, and tell me whether it's angular or translational. And if you do, and you can pick the level, you're in the pot for $500 cash out of my pocket. And I'm pretty much guarantee you that $500 is really safe in my pocket. We could have hundreds and hundreds and hundreds. We could have thousands of doctors. By random, one might get it right by guessing. But you'll see what the percentage is of doctors that really can see these things. And you'll see it's not very good. So take the challenge below, click the button below.